liberty, and justice for all. Welcome to the July 17th, 2017 meeting of the... Yes?
We're missing a clerk.
We are missing the clerk. There's nobody here yet.
Eric, would you take over there, please?
She must have just stepped out for a little because everything else is here. So.
Yeah. Thanks for pointing that out. I could have gone all day with that, actually. Join the party.
If we have a meeting without the clerk, did it really happen?
I said that. I have things to do if you really would just like.
We said the Pledge of Allegiance already. Are we ready to go? Got 'em? Okay. Welcome to the July 17th, 2017 meeting of the Shawnee County Board of Commissioners. My name is Bob Archer. I currently serve as chair of the commission and represent District 3 alongside Commissioner Shelley Bueller, who represents District 1, and Commissioner Kevin Cook, who represents District 2. Welcome. Good morning, everyone.
Good morning.
First item of business, please.
First item is proclamation presentations. Number 1, presentation of Vallejo's 2016 annual report. Bill Persinger, Jr., CEO.
Mr. Chairman, I'd like to introduce Frank Henderson, the president of our board, who will start the presentation this morning.
Good morning.
Good morning.
Chair Archer, Commissioners Bueller and Cook. I'm Frank Henderson. I have the honor of serving as chair of the Vallejo Behavioral Board this year, and I'm happy to be here, and thank you for allowing us the opportunity to present our annual report to you. Also want to acknowledge our fellow officers. We have Dick Klein, and everybody knows Dick, and Mike Wilson with us, and everyone knows Mike as well. And then I will be calling upon Bill later, and he will provide some of the more detailed things about Vallejo this past year, while I'll provide just an overview of the report and kind of some of the things that went on. First of all, I would say I would be remiss if I did not begin with a heartfelt thank you to each of you for your commitment to mental health and recovery. It is very evident as we present our quarterly reports that we have great support from the Commission, and we sincerely appreciate that. And the Commission and Vallejo has partnered together for over 50 years, and so we look forward to this continued partnership as we serve the citizens here. So it is with great pleasure I present to you our 2016 annual report. And Vallejo Behavioral Health Care continues to provide a wide array of services as outlined in the report, ranging from crisis intervention, addictions treatment, residential care, and our co-responder program with Topeka Police Department, just to name a few. Now, all the services that we provide focus back to our mission statement, which is to provide behavioral health, wellness, and recovery through excellence as the provider of choice for comprehensive, compassionate, and fiscally responsible outcomes-driven care. And as you know, 2016 was a challenging year financially for many social service agencies, and of course we at Vallejo was no exception to that. And we sincerely appreciate each and every dollar that you were able to provide to us, and that was a tremendous help. We sought and secured additional funding through the identification of contracts and grants. And one example is the agreement with CanCare MCOs, or managed care organizations, that links certain outcomes to additional payments. Additionally, we had developed an extensive efficiency plan to reduce expenses and yet retain the quality of services. And some of the examples include using attrition to eliminate several management positions and reassigning duties, streamlining the psychiatric medication payment scheduling, and the wholesale purchase of natural gas. Now, I would like to share with you some of the outcomes and numbers as I wrap up this summary. We have 316 staff members. That includes full-time and part-time. 7,397 individuals receive services through Vallejo Behavioral Health Care. 294 crisis interventions and screenings were conducted at the Shawnee County Jail. 1,532 contacts with vulnerable individuals on the street in working with law enforcement. And only 1% of those individuals resulted in incarceration. And with our primary care clinic, we reduced the ER room usage by 11%, and our guests reported a 28% improvement in overall health, well-being, and quality of life. 77% of social detox consumers successfully completed that program, and 99% of the individuals at risk that were presented for Osawatomie State Hospital placement were diverted. And of course, this resulted in a low census of Shawnee County residents at Osawatomie State Hospital. Okay, now I'll be happy to stand for questions, and if you have no specific questions for me, then I will ask our CEO, Bill Persinger, to come.
Questions or comments for Frank?
Thank
You know, I read those results, and they're remarkable.
They are.
They are truly remarkable, and wow, thank you. Next.
Well, thank you. Hey, Bill, I'd like to invite you to comment.
Appreciate it, Frank. Thank you. I might also start off with a heartfelt thank you for all the taxpayer dollars at all levels of government that Vallejo receives, and many, I'll probably point this out for the next 10 or 12 years. County funding is the bedrock of what we have in community mental health. Some of those dollars starting as early as the early 60s, in fact, and so we just can't say thank you enough, and we will wear out that record over and over again, saying thank you to the local taxpayers. You know, just this morning, actually, our CFO, got the financial report for June 30 done late Friday afternoon, and in preparation for a meeting this week. And I just thought I'd bring that in for your information. I apologize, couldn't get it to you much ahead of time, but it does contain our unaudited June 30 financial statements, and so looks like. We've just had a couple of pretty good months where we broke even in May and June, has helped the bottom line. We are behind by $204,000 expenses over revenues, and that's quite a number actually for us. It could have been a whole lot worse if we hadn't spent the last 16 or 18 months preparing for a time when we knew things would be tougher. So just got to say kudos to the employees who've taken on extra work and given us many, many ideas, which we've cataloged on how to make additional money and save money. And so we're at a place where somebody just said, give it to us in 5 seconds. I'd say we're holding our own. It could be better, but we're holding our own. We have some good news coming. The legislature was pretty good to us this year, and there's a couple things that didn't happen for us, but we had to focus on the positives, and so we look forward to some additional state funding. We'll be visiting with you folks in detail on Wednesday at 11 o'clock to present our budgetary request from the county for continued support in year number 51, which will be next year for Vallejo, and we look forward to that time with you, and these same gentlemen will be with me today. And I might also say that we have a pretty open conversational style at the Mental Health Center and at our board meetings, so I just want to invite any of the board members anytime they want to chime in, just to throw a paperclip at me or something, they can get my attention. So, what was significant, one of the significant things that Frank said a little bit ago was that we have working on some pilot agreements with the CanCare managed care companies. They manage Medicaid for the state of Kansas for all kinds of health care services, including mental health. And our field nationally is kind of shifting from what's called a fee-for-service. A person comes in, we provide a service, we bill somebody. We bill the individual, we bill an insurance company, we bill Medicaid. Of course, we rely on our grant funding and our other contracts to help, shore that up financially. So the system of healthcare, not just with Medicaid, but in fact, Medicare nationally kind of led the wave, is to look at providers in certain areas and say, well, if you can produce certain results, then you can get paid perhaps an additional fee or an incentive fee or a bonus, I guess. And it's called P for P, pay for performance. So a person comes in, they receive their health care, the doctor, the podiatrist, the therapist, the rehab person will bill a fee for service and get paid per usual. But the field is turning more and more towards results and outcomes and measuring those outcomes. And we sure appreciate your comments this morning about the outcomes that we've been able to analyze. We are just trying to, keep a log of what we do, but the results we get. So there's kind of this data that describes how much and where and when, and then there's what I call the so what data. Did anybody get better? Is society better off for it? Did we save any money? Did we get good results? Did we work with other agencies? So we're moving more and more towards a so what data, and I think we could do better. In fact, we'd like to someday do what's called a cost avoidance study and see if some of the critical programs we run, some of those street-level crisis-oriented programs that we operate, have a cost avoidance factor out in the community somewhere. And so I can say that if we have $1 in funding and we spend it in Shawnee County, we generate $4, $5, or $6. That's just how money moves around. I think in commercial businesses, I think those dollars sometimes drive it, probably $7 or $8 or $9. And Curtis could probably speak a lot better to that than I could. But we also think that because of what we do, there may be savings in other places, emergency rooms, law enforcement time, jail time. Is there a reduction in homelessness? Are more people finding housing? Are more families being reunited? So there's a lot of so what data that we'd like to study to see if we actually are creating savings somewhere in the community, and then that just benefits everyone. Haven't been able to afford to do that study yet. We had the money for it, but we've just been pretty careful about spending $17,000 to find out what that is. And we continue to look at that as a possibility, but we're waiting for a little better times before we call in Wichita State to do that study. They've done a kind of a pro forma study down in Sedgwick County. There's been other cost avoidance studies done in Texas and Oregon, and so we're just kind of borrowing from their data right now and thinking that, okay, if we have 2 licensed social workers out on the street every day from 8 a.m. to 11 p.m. It's called our co-responder program. They work right alongside law enforcement officers, and not only do they do some kind of routine work, but when there's a call, when there's a concern, they can team up and go out. And Frank alluded to that earlier. We know, I just know in my heart that there were people who avoided jail, or people who avoided an emergency room, or someone who avoided another kind of a problem in their life because we had that early contact with them. So we just like to be able to prove that someday. So we're just waiting for the right time to spend that money and do that study. And of course, those results will be shared with you as soon as we're able to obtain them. One of the nice things that happened is that we did receive a $40,000 check in June from one of the managed care organizations, based on the pilot study that I was referring to earlier. So to come a long way back around to where I started with so what data or outcomes data, and in response to your positive comments, Chairman, about our results, that's a direct payout of being able to achieve some positive results and being paid for that. It's one of the things that contributed to the $884 bottom line we had in June. So, but it's just creating those additional sources of income and looking at our expenses and trying to hold those down wherever we can. That has got us where we are today. Back to, I'd have to say, we're holding our own financially and trying to hang in there and looking forward to better days. So I might pause for a minute and see if you have any questions, and if there's a time when I need to be quiet, just push me out of here and I'll be done. But we do appreciate the opportunity to stand up here and tell you more about our story.
I don't think we ever get tired of hearing good news, Bill.
Oh, thank you. One of the things I want to do is when somebody asks, well, what does Vallejo do? What does it mean? Well, it means to have health. It means to be healthy. And so we do that in through 30 different programs, 300 plus staff and about a $20 million budget. And I try to just summarize it down as best I can as we help reunite families for adults who have mental illness and addiction, whether it's a small problem or a big problem. We try to help people find decent and affordable housing or to keep their housing. We try to help people recover from alcohol and drug abuse and mental illness, obviously, but we do that by helping people find jobs or keep jobs or go back to college or learn a trade or find a job that suits them. So that's really what we're about. But we do that through lots of confusing terminology that I didn't invent. Somebody else invented it, sometimes over my strenuous objection. I'm kind of a meat and potatoes sort of person. I like to call things what they are, but we have some fancy names for what they do. And what that boils down to is a caring, trained, well-supervised staff member at Vallejo, over 300 of them, who work in a lot of different places. And so, well, where are your offices? Well, we have 9 facilities here, and there's kind of one over here and one over there. But I encourage people to think of mental health and addictions treatment as a process and not a place. And of course, there are places where that happens. It might be under a bridge. It might be in someone's home. It might be in a physician's office. It might be in an emergency room. It might be in the privacy of a one-on-one counseling session in one of our facilities. But mental health, and I include addictions treatment in there, behavioral health is a process and not just a place. And so I want to just take a little bit of time, if I have a few more minutes, and pull out a few of those terms for what we do or the name of a program and just explain that a little bit. So everybody kind of has a pretty good idea, I think, of 24/7 crisis intervention. One of the really cool things about Vallejo, and there are some other mental health centers that offer this level of care as well, but 24 hours a day, a person can walk into our facility at 400 Southwest Oakley Avenue and be in front of a licensed therapist if they have a crisis in just a few minutes and get an evaluation. So I like to say 2 o'clock on Sunday afternoon or 2 o'clock Thursday morning or Christmas Eve. If a person has a problem and they need immediate attention, of course, we don't want to minimize the importance of our emergency rooms, and if people have a medical problem, they go there first and get checked out and then come to us if they have a mental health or an addictions crisis. But quite literally, mental health care is available 24 hours a day, 7 days a week, within just a few minutes. People can call our crisis number. They can come by our 400 facility and have an interview there, a private interview there, and kind of figure out where to go from there. So one of the programs that we have is called The Residence. That's at the 400 location, and it's basically a 72-hour program, although it could be an hour or it could be 5 or 6 days. It's a voluntary place people can stay. It's a time where they can get some care and attention, and it's a time when they can deal with their crisis in a private and supportive environment. And a lot of those folks, go through their crisis period. They go back home with supports, of course. We don't just say, okay, goodbye, come and see us next time. Some do go on to a psychiatric hospital, but because they stay with us for a day or 2 or 3, we think that psychiatric hospital stay is shortened. We do know that one of the outcomes before Vallejo built a new facility at 400, I think we opened that in October of 2014, state hospital people at the state hospital, Osawatomie, from Shawnee County would number about 14, 15 people, 16 people on any given day, and that's kind of a general number, an average. Now it's around 6 to 8, sometimes 9, and we've been able to do that not only through that 24/7 program at the residence where a person can stay for a half a day or 2 or 3 days and come back when they need to, but because of a lot of the other programs that we do. I might highlight case management. Sometimes you might hear the phrase targeted case management. The formal Medicaid term for that is community psychiatric supportive treatment, and that's exactly what it is. I guess it's a trained person, probably an individual with a bachelor's degree in psychology, social work, other areas who's assigned a caseload of people that they visit in their home on a regular basis, once or twice a week. Some people once a month, some oftener. And they just help that person with specific goals and objectives to manage money, find a job, find a house, deal with family problems, make sure medicine's being taken, all those things we can do to wrap around that person to make sure they adjust to the community. We have crisis case managers. Maybe a person comes out of our residence program at 400 and they need some extra help for a few days or a few weeks. We'll call in some additional troops, so to speak, and additional peer support or attendant care, case management time, where they come in and intensify the services to every day or multiple times in a day, before, during, and after hours. And then those services kind of will titrate down as the person continues to get back up on their feet. So we can apply some crisis or intensive services for a short time when people need them. Home-based services, we just refer to that in general. A lot of what we do occurs in people's homes where they live. A service you may hear a lot about is called peer support. When a person gets to a certain point in their recovery, when they're able to help others, we can hire them and pay them, and either by the hour or with a salary and benefit. They go through a training program that lasts a week, and then they're supervised as they go out and be a peer, be a friend, a helper to people who are at maybe a lower stage of recovery where they need additional help. So we, and have a long-standing practice, as do all the other mental health centers, of hiring people who are recovering from mental illness and/or addiction to go help others who are because they've been there. It's a very effective thing to do. The Community Medication Outreach Program, I want to mention that specifically. It's a program that operates 7 days a week. We have 80 or 90 people that we deliver medication, psychiatric medication, to their house, their place of residence, mainly because they can't come in, they can't get to us. So twice a day we deliver their medication. While we're not qualified to dispense medicine or to administer medication, we do have that packaged up by our in-house pharmacy or other pharmacies. And so the person knows what to take and when. We observe them taking it, make sure they're all right. They need other things, we can call in different assistance. But psychiatric medication is one of a number of things, like crisis intervention helps people stay at home and remain productive, to work, enjoy their family, enjoy their home, participate in society, like everybody wants to do. So I might just pause again for questions. The rest of our annual report just lays out kind of some of the highlights about Vallejo, our locations, our Creations of Hope gallery up at 909 North Kansas. A little shameless plug. You can go there and buy stuff from our artists. The artists receive 70% of what they sell, and there are artists who are recovering, artists who are in private business, and they are glad to tell you the story about what they do. So for sure, every first Friday, I think we're open every Friday afternoon and Saturday morning with volunteers who run the point of sale, and then of course on First Friday. So if you need some art of any kind, from arts and crafts to charcoals to oils to, I think there's a skull of a bison down there that, would look great in your man cave. So we want to sure plug our Creations of Hope gallery. We think that's a wonderful engagement tool for the community to see something about mental illness and addiction. And with some of that work, you can actually see a person's progress in life as they recover. So that's just a super cool thing that we have at Vallejo. We want to thank all of our artists and the board for supporting that. Mr. Chairman, I'll stop there and pause for questions, or if I've missed anything of importance, I'm sure our board members can add to the presentation.
Any questions or comments for Bill? I think we're making a good start on our budget talks for Wednesday, that's for sure.
Thank you. Our audit should be looked at. I think the board's going to see that next week, and then we'll get it to you just as soon as it's adopted. We had about a month's delay. We couldn't get some information from one of our payer sources, but that is forthcoming, and we'll get it down here to the clerk's office forthwith.
Okay. Thank you so much, Bill. Yes, Commissioner?
Commissioner Cook, did you have anything?
I think that there are times that a leader gets to stand on a flight deck and say mission accomplished, and we could look at the outcomes and say good job, but there's so much left yet to do for mental health in our community, and so much that remains to be addressed. And so I think this is but the tip of the iceberg of what we can do to help restore dignity and productivity to many of our community members.
Well said.
Second that. Thank you, Commissioner.
Well said. Yes.
Couldn't agree more. And the discussion about the cost avoidance, I know Brian Cole would be in full support of that as well. If we can bring the cost of what we allocate to the jail down and hopefully put those dollars into the beginning of treatment for people, then it
That'd be
gets
great.
people the help they need, because the need is still pretty significant out in our community for those who still have not sought treatment, correct?
Yes, very, very significant. We think that's an excellent place to work upstream, just like the co-responder program when the social workers are on the street Monday through Friday, 8 a.m., 11 p.m. We're also seeking grant money, see if we can get that 24/7. But, we can get to a problem early like that when, in fact, and what I want to say about Director Cole, Major Phelps, and others down there, they've been nothing but supportive and helpful, and we look forward to many years of continued partnership with them. I know one of the things that Director Cole and I will speak more about in the budget presentation are conversations with JUMP about, is there anything we can do at the county correctional facility to help people prepare for the workplace upon discharge? And the answer is yes, and then we've got some ideas about how to do that. So we had some good community involvement with that as well, and so I feel pretty excited about that. There's a lot of good things going on there. So
Good. Again, thank you, Bill.
thank you,
And
folks.
thank you,
Take
Frank
care.
and Mike. Next item, please.
Item 3, consent agenda.
I'll move approval.
Second.
Motion made to approve the consent agenda by Commissioner Bueller, seconded by Commissioner Cook. All in favor say aye, opposed no. Motion carries 3-0. Next item, please.
Item 4, new business. A, County Clerk, number 1, consider all voucher payments.
Commissioners, this morning we have vouchers that total $842,721.20. The highlight out of the voucher report was payroll, $546,930.64. Health insurance premiums of $139,129.29. Holding accounts for the state of Kansas motor vehicles, $41,033.28. Parks and Recreation, $36,911.44. And finally, workers' compensation premium of $35,263.42. I do not have any questions regarding the vouchers and would move for their approval.
Second.
Motion made to approve the vouchers by Commissioner Cook, seconded by Commissioner Bueller. All in favor say aye, opposed no. Motion carries 3-0. Next item, please.
Item A2, consider correction orders.
I'll move approval.
Second.
Motion made to approve the correction orders by Commissioner Bueller, seconded by Commissioner Cook. All in favor say aye, opposed no. Motion carries 3-0. Next item, please.
Item B, Health Department, number 1, consider authorization and execution of contract C-234-2017 with the Kansas Department of Health and Environment for grant funding in the amount of $4,000 to help control tuberculosis in Shawnee County.
Good morning, Commissioners. Linda Oakes from the Health Department. This is an annual agreement we have with the Kansas Department of Health and Environment to help pay for case management of folks with active tuberculosis, testing for contacts. Also, if we need to isolate someone during their contagious time, we can pay for that through this money and help with groceries and other bills when they can't be at work. And last year we received $2,000, and then you might remember about a month ago I came with another $1,500, so this is $4,000 for this year, and I'd be happy to answer any questions.
Questions or comments for Linda today?
Just
Yes, Commissioner Cook.
a little bit off of TB, but to which Sedgwick County, as they're dealing with a crisis with measles. How does Shawnee County Health Department respond to the communicable diseases such as TB or measles or other?
We are contacted either by a local provider that says, yes, we may have a case of tuberculosis or measles or whatever, or the Kansas Department of Health and Environment gets the report, they contact us. And then we have nurses who immediately begin an investigation to see who may be exposed. Is the person with the illness staying in isolation? Measles is a really scary disease, and I heard about that in Wichita over the weekend too. And I can tell you that you are contagious 4 days before you have symptoms, before the rash. You might have a fever and some other runny nose, those symptoms, and 4 days after the rash. So all those places in that article that you might see that people may have been with measles, they have to contact folks that were at those places. They were places like stores and a doctor's office, and so we would be running that contact investigation, and we would be calling everyone to say, hey, are you vaccinated? Do you need a vaccine? We would have clinics to do the vaccinations. So yes, we would definitely kick into high gear if we had measles or if we have a case of active tuberculosis. But most importantly, I think with tuberculosis, we provide that case management. So that nurse is that person's best friend for a while, and they're seeing that person daily, giving them medications, doing the test to see when they're not contagious. We do all those steps to make sure that no one else is exposed to the disease. Measles is so contagious. It's a really tough disease. I'll just say that too.
And it's grants like these that help offset those costs?
Yes, it is. And so if we had to have, if we had an outbreak and had to do vaccination, KDHE would help with vaccine and that kind of stuff too. They have in the past, so.
Good to know.
Thank you.
Sure.
I'll move approval.
Second.
Motion made to approve the contract by Commissioner Bueller, seconded by Commissioner Cook. All in favor, say aye. Opposed, no. Motion carries 3-0.
Thank you.
Linda. Next item, please.
Item C, Parks and Recreation. Number 1, consider authorization and execution of contract C-235-2017 with Bright Circle, Inc. for management of the Val McKay Paris preschool program with compensation of $525 monthly for 2 years.
Good morning, Commissioners. Susan Fowler-Hensler, Superintendent Parks of Recreation. Before you today are 2 more contracts similar to the one you approved last week at Shawnee North. Our master plan does have operation goals outlined in it to develop staffing plans for recreation services and also to develop partnership plans, inviting new partners in and managing our facilities and programs. I'm kind of excited that I'm getting to use the word partners and partnerships just as much as the phrase master plan anymore. So this is another group that has done a great job for several years now with our preschools. The first one here at Ville McKay Paris, they have about 30 students right now, but are actually starting to see that grow a little bit. I think also having the partnership with Boys and Girls Club down at the Ville McKay Paris is going to start to bring even more families into that community centers. So they continue to get good reviews. Their curriculum is of high standards. They have a great reputation. I kind of wanted to mention too, I do get asked why preschool and recreation together, but I just wanted to note that preschool is more than just academics. It's learning social skills. It's learning those large and small motor skills that you might learn also when doing sports. And it's also about arts and music and the fine arts. So it's an excellent program that fits in with our vision with Parks and Recreation. I'll be happy to answer any other questions if you'd like.
Questions for Susan?
I move for approval.
Second.
Motion made to approve the contract by Commissioner Cook, seconded by Commissioner Bueller. All in favor, say aye. Opposed, say no. Motion carries 3-0.
Great.
Next item,
Thank
please.
you.
Item C2, consider authorization and execution of contract C-236-2017 with Bright Circle, Inc. for management of a Lake Shawnee preschool program with compensation of $7,200 annually through May 15, 2018, with the option to renew through May 2019.
Good morning, Commissioners. And again, this is with Bright Circle, and they have been at the lake for several years. This particular preschool has high attendance. They have right now 58 students out of 60 spots, so they stay right there pretty full most of the years that they've been there. And again, same comments at the lake. They have wonderful curriculum, a great reputation with the community, and continue to be offering services that we're our quality services we're proud to be partners with. I'll be happy to answer any questions.
Thank you again. I'll make a motion to approve the contract.
I'll second.
Motion made to approve by Commissioner Archer, seconded by Commissioner Bueller. All in favor say aye. Opposed, no. Motion carries 3-0.
Thank you.
Thank you again, Susan. Next item, please.
Item D, Commission, number 1, consider approval of letter to Secretary of State Chris Kobach regarding the proposed 2018 budget of the Shawnee County Election Office.
Yes, Commissioners, I propose that we send this letter to the Secretary of State. I know it's been brought up why we didn't discuss these issues at the budget hearing for the Elections Commissioner, and quite frankly, we got the information so late from his office, and I wanted the county councilor and our finance director to review what I thought were disturbing comparisons and compensation plans. They did, and this letter is in response to that request from the budget. You know, I know that the Secretary of State takes great pride in the fact that he's reduced his staff and expenses significantly in his office, and I admire that. I just wish that that mindset had cascaded down to the Shawnee County Elections Commission office, and it hasn't. So I'll move that we send that letter to...
Commissioner, if I may, I'd like to actually make a couple of comments.
Absolutely. Absolutely, sir.
I appreciate the opportunity to actually respond to these comments. So thank you for allowing for that.
Yes, sir.
A couple of things that I think we need to talk about. First of all, I am disappointed in the approach that you've taken on this matter. Like you said, it's simply brought to the press. I've never been consulted on any of these matters, and I think there's some claims that are made here that are inaccurate, so I'm going to address those because I think it's appropriate. I also think that we need to be careful on these kinds of matters, that we have a public discussion, that we interact with each other, that we are respectful, and that we do consider all of the things that you brought up. So, again, I'm going to release a document today to respond to what I believe is some incorrect information that Commissioner Archer has provided. And again, this is not an attack. I'm only responding to some statements that have been made. I've been very careful to be respectful of the County Commission. I appreciate that the work that you do. I know that it's difficult work. I've been elected before. I understand those concerns. I was surprised that at my budget hearing I was not allowed an opportunity to make comments or respond to any questions you had. There simply were no questions at that time. So, again, we did revise our certification document to you because we did find a small error in it. Again, staff does make errors from time to time. We found that and we did correct that. I wish that the budget hearing had lasted more than 10 minutes. Unfortunately, it did not, and I stood there for any questions you had at that time. The public is welcome to review the video on the Shawnee County's website. I prefer not to have these discussions through the media. I think that we should have interaction and comment and, frankly, a robust discussion because I think the public and the press deserves to hear our comments in front of everyone. I think it's important to say that I was not the one that asked for a 51% pay increase. I think we all know that the CBIZ study was conducted by the County Commission. You've publicly stated that you wanted to fulfill that for every employee in Shawnee County. If you choose not to do that, it is your call. I understand that, but I think it's important if you're going to make a claim that a 51% pay increase was requested, let's be clear, that came from the County Commission. They authorized the CBIZ study. I still have the email if somebody wants to see it where it was outlined that my salary, if you compare it to your own parameters, should be $93,000. So let's be clear about that. Second, the 2016 budget, and I've stated this numerous times, the 2016 budget was not overspent by my office. The statute requires that the county place the actual certified budget into the county's budget for the ensuing budget year, and I've included those statutes here. So I have long stated that I actually was under budget by $161,000. So I do take umbrage to a statement that I'm exceeding the requirements. Additionally, if we don't consider that fact, let's just say that that's not the law. I've communicated clearly with each of you personally to the best of my ability to explain the issues related to the budget, to explain the expenses that are required. I think it's important to note that the election office for the past 10 years has essentially been a flat budget. The only increase of any consequence that has occurred in the last couple of years because, and I appreciate the space and I've given credit to the County Commission for the building that you've given us. I think it's functional. I think it works well. It costs a little more, but it really was needed and was necessary. So thank you for doing that. And I publicly stated, I know it costs money. I'm not unaware of that. That was not a decision that was mine to make. It was done before I was election commissioner. Additionally, we have over $250,000 worth of increased costs related to the election equipment and the contracts that are related to it. So I think that we need to recognize, if we're talking about an increase in budget, we've been essentially flat up until the last couple of years, at which time the equipment contracts and the buildings and some of the increased costs, which I think are reasonable for employee additional pay, are a part of the program. So again, we're basically running, if you allow for those exceptions, on the same budget that occurred in 2008, 2012, and 2014. New election equipment simply costs more money. There's no way around it. The life expectancy of the former election equipment was 12 to 15 years. We made it last for 25 years, and I think we ought to get credit for that work, including the county commission, for making that equipment last longer. I also think we ought to acknowledge that the joint RFP that we did with other counties across the state has saved Shawnee County over $300,000. We've asked our vendor for those numbers. We've saved significant money as a result of the way we handled that RFP. Again, I think these things need to be talked about publicly. I've given every one of you my cell phone number. I've said I'm willing to meet with you 24 hours a day. Call me, I will talk to you, and we will meet and discuss anything at any time. I'm transparent, and I'm ready to talk about whatever, whenever. My pledge to the voters of Shawnee County has always been and will be to keep the cost of elections as low as possible. But we will always follow all statutes, and sometimes that costs what it costs. When you have 3 times the number of people coming through the office as a result of a well-run advanced voting program, then it's going to cost more money additionally. Again, I've got other comments. I don't want to take over your entire meeting. I know you have other matters to attend to, but I'm going to release this statement. I think it's important that we look at all the issues. And again, I'm more than happy to meet with any of you at any time to discuss any budgetary questions, to talk about anything that you want to talk about. And I think that's the appropriate methodology that we should be using to deal with any disagreements or complaints that any of us have, quite frankly. So thank you for the opportunity to make these comments. I do appreciate it. I think it's important that we actually converse with each other and talk about whatever misunderstandings or disagreements we may have. But I guess I'm encouraging each of you, if you think that I'm being disrespectful, I want to be clear, I'm not. The chart that I used was not an intent on my part to attack the county commission. It was simply the only available information I could find on the county's website that gave a decent comparison about budgets. So, and I also think really the point that I was trying to make with my budget comparison was the trend line showing that the election office is effectively slightly down in cost, except for those most recent changes with personnel and the building. And again, the statement in the press that I find probably the most inaccurate is claiming that I'm asking for a 51% pay increase, when in fact that came from the county's own CBIZ study. So I just think it's important to correct those statements and say that that's where that came from. If you have any questions, I'll be happy to try to answer those.
Well, the fact is, you did put that in your budget. The CBIZ study, for everyone who wants to know, is based on competence. And I would suggest that a leader who can't manage their budget is not totally competent. So that's my point on that. Commissioner Bueller, did you have anything, thoughts?
Andrew, the fact that we didn't resolve the 2016 budget issue, the general fund basically absorbed the amount that was over, if that's if that's correct. But we haven't been able to resolve that, and the difference between the certified and the adopted budget for the commission is still something that I think needs to have a public discussion. It's taxpayer dollars. And so, and then with the submission of the 2018 budget, I didn't see any willingness to have any discussion or any resolution there either. So while it's unfortunate that I think we have to take this action by sending this letter, I don't think it gets us to resolution, but I don't think we're left with many options, very few options, if any. So that's all I have to say.
Commissioner Cook, thoughts?
I concur with the statements made by the Commissioner Bueller. if we look at the 2016 budget, Andrew, rather than explain the reasons, you immediately go to a defensive mode of a certified budget. And that's the first time that discussion has come up. Never before was that issue raised, except for when it was pointed out that you had gone over the budget and was absorbed by the general fund. Rather than a spirit of cooperation, you took on an adversarial tone. The CBIZ study is not a mandate, it's not a requirement. It's a suggestion. Your budget does present a 51% increase to your salary. And you submitted the amended budget the day of the hearing, minutes before the budget hearing. Additionally, your 2018 budget isn't a compromise, it isn't a discussion, it's a demand. And when met with a demand, that's not a discussion. So it's unfortunate we're in this spot, but I think the letter's appropriate.
I guess a couple of things. The only thing I would respond to as it relates to the amendment was we found a minor clerical error. It was simply a draft that staff printed the wrong copy of, so there was no substantial actual difference in the amended copy. So it's unfortunate that we didn't see it sooner, but we didn't, and we changed that, so I think that's clear. Again, I have, and we've actually worked at this. We've actually asked your staff to visit with the Secretary of State's folks and talk in detail about how the statute works, what it says. And again, I actually prefer not to go into an adversarial mode, but when people make statements saying I've missed a budget, I think I have to respond to those. I don't believe I have missed a budget. I think the law is very clear that says that the county shall cause the same, speaking about the certified budget from the election commissioner, to be included in the county budget for such ensuing budget year. The county commission has steadfastly refused to do that. So I think I have to, when I'm pushed with statements that I do not agree with or characterizations that I don't think are fair, I think I have to respond with that. Again, that's not where I started the discussion, but I think that that is where we're at. I think that that is correct.
I'll move to send the letter.
Go ahead.
I'll second.
I do have one question for the
Commissioner.
county councilor at this time. As far as an opinion on that statute, is the Attorney General looking into that? I seem to remember there was some discussion about that.
Yes, the Secretary of State's office has requested an Attorney General opinion on that statute. The Kansas Association of Counties was asked to provide input from the county perspective on that, and they did, and I haven't seen a result on that. Regardless, Attorney General opinions are simply opinions from the attorney. Before we would need an opinion from a court before we have something authoritative on that. Attorney General opinions, I'm not dismissing them. They can be persuasive, but we also have to understand the context in which they are rendered.
Exactly.
But in theory, County Councilor, under this theory of the elections commissioner, he could double his budget. He could triple his budget. He could double his compensation. He could do anything he wanted to, as long as there was no oversight that this county commission would provide.
That seems to be the position they're advocating.
And that's unacceptable to me.
And that would not only happen in Shawnee County, but the other counties where the Secretary of State appoints
Exactly.
Correct.
the commissioner. Okay.
Commissioner, I don't know if there's public, I know previously there was members of the
Yeah, I think
present
there
that wanted
is.
to comment before we take a vote.
Okay. If others want to comment, please come forward.
Thank you very much. My name is Randy Gregg. I'm a long-time, full-time Topeka resident. I had my own tire business for 50 years. I referee high school football. I've done that for 49 years. So when I do a job, I stick with it. I'm a part-time employee now for the election office. And I just wanted you to know, from my point of view, how efficiently that office is being run. And the primary example is the November general election, where we advance voted 15,000 voters, and nobody waited more than 5 minutes. And that's just an example of how precisely the commissioner runs his office. He's very, I'm involved with getting ready for the elections, helping run the elections, and then shutting everything down after the election, and I'm done till the next election. So just part-time, but I just want you to know that I feel it's a very well-run operation, and I think probably he doesn't deserve some of the flack he's catching. Thank you very much.
Thank you for your comments, Randy.
Good morning. My name is Steve Sutherland. Like Randy, I am a tech specialist at the election office. Been working with Mr. Howell and his group for a number of years now. And I can only echo what he said in that this is an efficiently run office, extremely efficiently run. Mr. Howell has to wrangle some 800 board workers each election in order to effect these processes. He does that extremely well, as Randy said, flawless advance voting. And all the numbers are somewhat overwhelming in my mind, but I can give you some specificity. We have a new law regarding advance voting. It involves some changes. Over 100 voting places in Shawnee County are affected, obviously, and this change has been affected by Mr. Howell at the cost of less than $100. Less than $100. That's how cost conscious he is, and he's doing a great job. Thank you.
Thank you for your comments. Anyone else? Motion made to approve by Commissioner Archer, seconded by Commissioner Cook. All in favor say aye. Opposed say no. Motion carries 3-0. Next item, please.
Item 5, Administrative Communications.
Administrative Communications.
Good morning, Commissioners. Randy Luby with Parks and Recreation. This week at the Bettis Family Sports Complex and the Lake Shawnee Softball Complex, they both play host to the U.S. AAA Midwest C Division National Championships that will be starting. Opening ceremonies is on July 19th, which is Wednesday, and will play through the 22nd. Right now we have 41 teams, and 26 of those are from out of state. We're expecting an economic impact of roughly $750,000, which is an awesome 3 or 4 day event. Commissioner Bueller will be doing the welcoming address on Wednesday night. And that opening ceremonies will be at TPAC starting at 7. The players will be coming in at 6 o'clock, and they'll all be marching in. It's a pretty awesome sight to see with all the banners and all the different states represented. They will be starting, the teams will be arriving on Wednesday morning of check-in, and then they do a skills competition in the afternoon. We're looking forward to that. Derek Mead is here. He's the gentleman that will be in charge of the event on our end. And I look forward to his report at the end with actual numbers and how everything went. So if you have any questions, I'd be glad to try to answer them, or Derek.
Thank you, Randy.
Thank you.
I'll take this time, though, to thank Randy and David and John for the 10-year anniversary celebration at the pool. Greatly appreciate all the work that you all
The hot
do.
dogs are really good.
I'll tell Chief McKenzie. And we had former Commissioner Ted Inslee come out and visit
Wow.
for the opening as well.
Cool.
So,
Andrew Howell, Shawnee County Election Commissioner. Just I guess a public notice again, Commissioners. We are having early voting in the office from 8 a.m. to 6 p.m. this week. I do want to give people who are working an extra hour, so we're actually staying open until 6 p.m. all throughout the week, Monday through Friday, at our office at 3420 Southwest Van Buren. I think it's important to provide that additional opportunity for voters, especially those that work until 5. If you have questions, call the office. If you 251-5900 if you got questions about your status. Again, just a public notice. Don't forget that mayor's primary, City of Topeka, is going on currently. Thank you.
On that note, Commissioners, Curtis Sneeden, Greater Topeka Chamber of Commerce, and we are pleased to make sure that you know about an event that's coming up on Wednesday evening, which we think will be the premier opportunity for our voters to get to know their mayoral candidates. We will be having a mayoral forum on Wednesday evening, the 19th, at the Jayhawk Theater. All 5 of the candidates have agreed to come. The doors will open at 6 o'clock. We'll have an informal reception beforehand, and then the forum will begin at 7. We'll have representatives of all the major media outlets here who will be taking part in the questioning. Our moderator will be Eugene Williams, so if you're available that evening, I encourage you to come by. It should be a special and unique event on the eve of our primary election on August 1. Thank you.
And thank you for sponsoring that, Curtis. That's important.
Yes, sir. Thank you. That's why I brought this piece of paper. The Chamber of Commerce is a sponsor, but so is Downtown Topeka, Inc., Community Resources Council, Forge, the YWCA, Topeka and Shawnee County Public Library, and the League of Women Voters of Topeka and Shawnee County. Our technology sponsor is SciTech, and Millennium Cafe and Townsite Cafe are sponsoring the reception. Thank you for the reminder. It's a big group.
All right.
Thank you.
Thank you, Curtis.
Good morning, Commissioners. Justin Gregory, Kansas Expo Center. Report on the Sunflower State Games that we hosted at the Kansas Expo Center this weekend. I had an incredible turnout. Over 3,000 people attended the one-day event. I don't even believe the event planners had expected that many people. Moving on, this Thursday we welcome the beginning of the Shawnee County Fair, which will run through Sunday, and also again our third Thursday event in Heritage Hall will be Thursday evening, and that is again a casino-themed event, so come on out. We will have the air conditioning on in Heritage Hall. It's going to be a little warm. And I would like to say that I will be at the softball tournament this weekend, all weekend with my daughter, and I do appreciate the great Topeka weather that we've got ordered for our visitors in town. So, any questions?
No, thank you, Justin. Thank you very much. Anyone else this morning? Commissioner Cook?
Just a thanks to Parks and Recreation as the bicycle event over at Oakland as we got kicked off, welcoming a new partnership, again using that word partnerships, between Parks and Recreation, Shawnee County, and other organizations. So, thank you.
Commissioner Bueller, pool party?
Parks and Recreation, they were very busy this weekend, so just thank you also for the Shawnee County Baseball Hall of Fame. Congratulations to all the inductees. And those sponsors, WIBW-TV, Parish Hotels, and Apple Market. But it was a very nice evening. Rachel did a great job. I don't know who all helped her, but it was a very nice evening. So you helped her? All. Oh, all you. Okay.
Next item, please.
Item 6, executive session.
There is a need for an executive session, and I'll make a motion to go into executive session for a period not to exceed 10 minutes for preliminary discussions relating to the acquisition of real property to further planned parks and rec facilities. So that is a motion. And let me point out that we do have budget hearings again today. At 10 o'clock, Keep America Beautiful. That will obviously start.
We actually had to back that one up to 10:15.
Okay.
And put it out on the website, and then the next one would be 10:30.
Okay, 10:15. 10:30 would be Safe Streets. The district attorney at 11. The courts at 1 o'clock, and the sheriff at 2 o'clock this afternoon. So I just wanted to clarify that before we go into executive session. Motion to go into executive session by Commissioner Archer, seconded by Commissioner Bueller. All in favor say aye. Opposed, no. Motion carries 3-0. We are in executive session. Are we ready?
Yeah.
I'm sorry.
Yeah, I'm sorry. You're fine. Go ahead.
Okay.
Yeah.
We are back from executive session. No action is required, so we're officially adjourned, and we will reconvene in 7 minutes to talk budget with Felicia McCabe.